My name is James Jesse Burley, and I give permission to healthcare for all Oregon. I guess the first thing I'd like to talk about was an accident I had on my hand. I had a piece of glass cut my tendon. I didn't have health insurance at the time. Getting into the emergency room was quite the pain. They almost didn't even let me into the hospital. After that, they organized a plan for my surgery. We got the surgery done, but after the surgery was done, they basically kicked me out of the hospital without any follow-up plan. I had no idea what I was supposed to do, so I ended up taking off the cast early so I could go back to work because I had to pay my rent. Now I have a deformed finger. Second thing I'd like to talk about, I guess, would be my teeth. Once again, I didn't have health insurance at the time. It was just out of my price range. And I got into a situation where my teeth were pretty much taken out of my mouth by things out of my control. The doctor scheduled me because I couldn't afford emergency care. He scheduled me for 3 months after I saw the visit in order to save my teeth. 3 months later, I came back and he told me he couldn't save my teeth because they're too far gone. And I was so upset because he could have saved my teeth 3 months ago. And now I don't have teeth. I guess the last thing I'd like to talk about is my legs. For 4 years, I kept telling my doctor that I'm experiencing a lot of pain. And my doctor kept presuming I was trying to get pain pills for something I made up for 4 years until I finally got an MRI, which he was very reluctant to do. And then we found out what I had. By then, it's too late for cell therapy or bone grafts or anything. They just have to go now.
So what part of your leg was affected?
Both my hips.
Oh, in the hips. Okay.
Mm-hmm.
So what's happening to those hips?
It's called osteonecrosis.
Oh, yeah.
It's a bone death.
So what will you need now?
Double hip replacement. He just said they got to go.
And how do you imagine that will be paid for?
I have no idea. I hope they don't know that so I can get the surgery done.
Yeah. Okay.
I'm probably looking at bills way beyond my control.
Okay. All right. Do you have any recommendations for our leaders, our governmental leaders?
Preventative maintenance will save a lot of anguish on other people. Not being able to afford my teeth has caused me severe depression, which has burdened the system. Not being able to move my hand properly has caused me some jobs, which is detrimental to my position in society. My legs, for God's sakes, I mean, it's just too much.